Okay. Let's see who's here. Leslie Cumberbatch. I'm hoping that's a picture. Either that or you're not moving much. Look very stationary. Luke Salmon, fishing for salmon. You go, boy. Gary Murphy, another good Irishman, such as myself. Leslie Cumberbatch. Are you related to the actor? What's his name? Something Cumberbatch? I forget. Funny looking guy. You're much better looking, if you don't mind my saying. If that isn't weird. Okay. Waiting for our speaker to show up. She'll be here soon, I hope. Dr. Graves. Let me check my email real quick to make sure it wasn't a problem. I don't know if I sent her the link. I'm going to send it right now, just in case I didn't. Come on and zoom, 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 zoom. Okay. I'm hoping, see, this has all been a little bit, see the pants here lately. Things have been crazy around here. And I'm pretty sure I sent her the link to give this talk, but if not, I just sent it. So hopefully she's checking her email. If not, I'm just going to tell you a bunch of jokes, about 45 minutes worth of jokes, and then you can go away. But waiting for our speaker to come could be my fault. We're not going to blame her. Okay, so if you come in a little late, We're waiting for a speaker to show up. Not sure if she doesn't come, it's probably my fault. So I'm not sure if I send her the link or not, but we'll just give her another 5 minutes or so. We'll see how that works out. Okay. How you doing, buddy? Okay, we've got 46 people here and one dog. The Evans Cujo. Benedict Cumberbatch. That's the name I was trying to come up with. I am old. Memory fading. Okay, so we'll stick around here, wait another 5 or 10 minutes. Again, it's been a crazy week at my end, so I'm not sure if I sent her the link. I just sent it to her. She checks her email checks her email now, she'll find it. But if not, we may just have to cancel class tonight. It's no big deal. Sandra Owuso. I've got a friend whose name is Owiso. Owusu. Owiso. My friend Owiso Makuku. What are we doing now? Who's coming in? The big K. Kamani Barrett. My Nguyen's here. Hello, My Nguyen. Me. Sorry. Doing that. I'm sorry.
Yes, okay.
How long have I known you? 4 years, and I'm still getting it wrong.
Yes, okay. Everyone got it wrong one time, so I'm used to it.
Yeah, I'm looking through my email here. I don't think I sent her this link. Let's check again. Oh, I did send it to her. There it is. Okay, good. So hopefully she's got it. Hopefully she'll come by. We'll give her a few more minutes. Let's see. Do I have any jokes while we're waiting? Let's see. That one. Sade has come. Thank you, Sade.
You're welcome. I hope you're feeling better.
Oh, thank you. Thank you. Yeah, we got the funeral tomorrow morning. We got a lot of people here. Anyway, 53 out of 100, 54 out of 100. You know, she may have forgotten. I know I forget a lot of stuff. So if she doesn't show, we'll give her till 10 after. And if she doesn't show, we'll just call it a night. Oh, who's this? Michael? Oh, this is Michael Graves. So it's Athena Graves. You need to unmute yourself, Athena. You're muted.
There we go. Is that better?
Let me see if I can make your picture bigger.
Okay.
Post.
Is there some way that I can see so when I'm holding stuff up?
Chat, rename, pin video. Pin video, what does that mean? Oh, there we go. I did it. I did it. Technology. Okay. So I'd like to introduce Dr. Athena Graves. She's under the name Michael because her son Michael is a Plattsburgh student. Is he still here or is he take?
And
You told me he took a semester off or something?
he did. He joined the Air National Guard.
Nice. Excellent. Okay, so she's a local dentist. So if you need your teeth done, she's here. If not, she's here to tell you how to become a dentist. So I'm going to
That's
give
right.
Dr. Graves.
Hi, everyone. First, if there are any questions, please let me know. I'm happy to answer them. I don't quite know how I'm going to get the question unless I hear you speak. So I'm new to this whole Zoom thing.
I have my chat window open. If you've got a question, chat it, and then I'll get her attention and I'll ask the question.
Great. That would work perfect. We don't really have to use Zoom in dentistry at all, which is to my benefit since I really don't know how to do it. So to start with, I hope that there might be someone who's interested in dentistry. Oftentimes people don't think of it as one of the health professions that they're readily thinking about. So they think about physicians or nursing, but dentistry is really pretty awesome in my opinion. Maybe because I am one. But there's also a few things. So I just wanted to kind of, I had written down a few things. So let me get that up. A big thing is when you become a dentist, you are already there. You're able to do surgeries. You are working in really small environments. And if those things are something you like, or you're thinking about going into a profession where you can do surgery, but you're specialized right away, it's great. So some things that are very important in dentistry are communication skills. I am talking normally to patients pretty much the whole time I'm working on them. One, to calm them down. Two, to get their mind off what's going on, because nobody really wants to go to the dentist. And I hear that on a daily basis. So you have to have a little bit of a thick skin because people are going to say things like, I hate the dentist. I hate being here. I'll ask people how they are today. You'll get things like, I'm here, which isn't really a great answer. But I can understand it because nobody wants to be there. Nobody really wants to be sick, injured, hurting. And that's with any health profession. So whether you become a nurse, whether you become a physician, whether you become a dentist, or whatever it is, nobody wants to be sick or ill or hurting, like I said. So that's something I think all of us in the health professions have to realize, that you are dealing with people who usually aren't healthy. I mean, for something like a cleaning, in dentistry, that's one thing, but for the most part, when I'm seeing them, there's actually something else going on. So communication skills are really important, like I said, because a lot of times you have to describe to them something that they're unaware of. I use a lot of visual aids when I do this. So one of the things I have is like a little book that I can hold up for you guys. So a lot of times when I'm talking to a patient, I'll talk to them about their tooth, say, and there's a cavity, this is the nerve inside the tooth, those kind of things. Explaining to them maybe that it's gotten really bad and it's now into the nerve and it has to have a root canal. And those are all things I'll go over in a minute, like what those things mean, because a lot of times you guys may have just been to the dentist for, say, cleaning or braces, something like that. But there's a lot of other factors, or a lot of other professions within dentistry. So it isn't just about your usual dentist visit. Kind of skipping around a lot here. Let me go back to some skills that are necessary to become a dentist. Being very detail oriented. That's very important because so much of it is on a very, very small scale. And to be detail oriented, you are looking at things that are, our measurements are in 10th millimeters. So it's small. So you've got to really like working in a small environment. I wear loops when I'm working. It really helps me out. A lot of people, most dentists I know do. You have to have good dexterity. So if you're, if that's not for you, then that's okay. So dexterity, some people who, like to sew or do models or things like that, those are all really kind of fun things that you can do outside of it. Having an artistic eye is important as well because you're looking at someone's smile, you're looking at their face. And that's an important part of it. Leadership skills. Most dentists are owners of offices or working group offices where they are the leaders in those offices. There are a lot of other options in dentistry, and I'll get to those in a minute. Organizational skills, you have to have patience with your patients because they're, again, scared. They don't know what's going on. You want to explain things to them. Problem solving skills, that's important with any healthcare profession. So those are some big ones. So some different things, different jobs that you might find in dentistry. You're all probably really familiar with the regular general dentist who you go to on a, every 6 months, get your cleaning, maybe get a filling. Maybe something more than that if you've had some trauma or something like that, broke a front tooth or something like that. And so you're all pretty familiar with that, but there's a lot of other aspects when you become a dentist that you can do. There's oral surgery. There is endodontics, which is specializing just in root canals, which is actually kind of cool to go into a specialty, I think. There is like orthodontics, your braces. A lot of you may have had something like that. But some of the things that we don't think about, like pediatric dentistry, you're just working with kids. Let me see, I'm on the list. Periodontics. So periodontics is a specialty that's related just to the gums. And so with periodontics, you're dealing with things like this, where we don't actually peel people's gums back, just so you know. But if you were to look underneath the gums, I don't know if you guys can see that or not. For the most part, there's, good, nice bone. The teeth are strong. They're in there. They're not moving. But when there's gum disease that goes on, you'll end up with something that underneath the gums is going to look more like that, where the bone levels have really gone up. This is loss of bone in those areas. Sometimes the teeth get mobile. There's some tartar and plaque that goes underneath and gets really kind of yuck. And so you're dealing with things like this and how to correct it. As a general dentist, you can do all of these different specialties, just not to the level that a specialist would be doing. So with something like this, the teeth can get loose, they can start to splay out. I don't know if you guys can see that. And with that, teeth can even come out eventually when it's bad enough. So when someone has periodontal disease, oftentimes they'll see a periodontist or someone who specializes just in the gums and the relationship of the teeth to the bone. In addition to that, periodontists will often place implants and do different types of surgery. Say on the gums, if the gums are pulling back from an area, this isn't going to really show that well, but if the gums were pulling back from an area, they can do some grafting where they take a piece from the roof of the mouth and surgically put it over that area. So there's a lot of different things within periodontics, at least that I find interesting. Another specialty is something called prosthodontics, where you're making all sorts of different appliances for the mouth. something like a denture. That's a type of prosthodontics. But oftentimes with prosthodontics, when you're a specialty, you're not just making a denture unless it is for someone who maybe has loss or their hard palate due to cancer, and that might even be a separate specialty within prosthodontics. Creating something, if someone's lost their palate, if they were to try to eat, their food would go through their nose. So when they went to swallow, so I'm making a denture that has a piece that would actually cover that area, things like that. So prosthodontics is more of a specialty of taking care of missing teeth. But then some of the other ones are like public health in dentistry. There's epidemiology in dentistry. There's oral and maxillofacial radiology. There's anesthesia. That's a new specialty that's out there. So you might just go around and anesthetize people for getting their dental work done. And what I mean by that is you're actually putting them to sleep so that they can get the work done, not actually like numbing them up. A general dentist can do that. And so oral surgery, I think I may have mentioned that one. Oral pathology, that's more in line with taking care of people who may have oral cancers and things like that. So there's a lot of different specialties within dentistry itself that a lot of people don't think about. So that's something that's kind of cool to think about. If you're interested in any of those things, you do become a dentist first, and then from there you take your specialty. You can do a general practice residency, but your residency itself is going to either go into a general practice residency where you want to become a general dentist doing a bunch of different things, or you can go into, one of these specialties. They are competitive once you're in dental school, particularly like orthodontics. That's one of the most competitive ones to get into, but it's also really, really interesting. But a lot of people think, I've had some people come to my office and observe and see what it's like just to be at a general dentist's office. And they're like, oh, I don't want to be a dentist. I just want to be an orthodontist. This is really shaky, sorry. So what happens is that's not how it works. You actually have to become a dentist first, and then you can get to go into one of the specialties. Just like with medicine, if you decide you want to be a cardiologist, you become a physician first, and then you do a cardiology residency. So with dentistry, it's very similar. Oral surgery, depending on where you go, you would do your 4 years of dental school and then get into, say, an oral surgery residency where you would complete your last 2 years of medical school and then do a surgery residency specific for oral and maxillofacial surgery. It's about 6 years after dental school, because the 2 years of medical school, then a 4-year surgery residency for that. But you end up with your DDS or DMD, which, by the way, same thing. So if you're looking at that and you're like, what does DDS mean versus DMD? It's actually the same thing. It's just the school that you happen to go to and what they've decided to call themselves. One is a Latin term and one is an English term. So it's Doctor of Dental Surgery, that's DDS. And then there's DMD, which is some Latin term, Doctor Medical Dentaris or something like that. Don't quote me on that one. My Latin is bad. So just that, I hope that clears that up. So any kind of dental school you're going to is going to be, in the United States, it's probably going to be an accredited dental school, as far as I know. And there's many of them. So to become a specialist, back to that again, say it's orthodontics that you're interested in, you go to dental school, you get good grades, and you can look at being an orthodontist. And it's that one's a 3-year residency, I believe. It used to be 2, I think it's 3 now. Oral surgery, like I said, it's about a 6-year residency. Other ones, it all depends on what you're doing. Some are 1 year, some are 2, some are 3. And then from there, this is something that's a little bit different than with medicine, as far as I know. When you become a specialist, a board certified specialist in dentistry, you no longer can do anything else. So if you become a board certified endodontist, which is doing the root canals, which goes inside and cleans that area out, you can't do anything else. That's it. I'm not sure why those are the rules, but they are. So you can't go and do a filling on the top of it or do a crown on it afterwards or anything like that. You can only do what your specialty is for. So a pediatric dentist can work on kids, not adults. An oral surgeon, oral and maxillofacial surgery, you've gone 10 years to school after college, yet you're doing surgery. That's what you're doing. You're not doing regular dentistry. So that's just an interesting little fact, in case you're thinking about doing, becoming a dentist and doing that. So becoming a dentist, that's an interesting topic that I think might be something some of you might want to hear. So what you do, you start with your 4 years of college. You don't actually have to go all 4 years, but I'm pretty sure you're going to need to, because there are certain classes you need to take. You need to take biology, chemistry, organic chemistry, I believe calculus. They might have a psychology requirement now, an English class, math. I think I said math. So there's a few different things that are actually required classes you have to take. Once you take those, you then take your DATs, which is like the dental version of the MCAT. A lot of the same kind of questions on it. There's a lot of organic chemistry on it. There's physics. That's another class you need to take. And in addition to that, there's another section on spatial relations. And that's where, just having a keen eye for things is important, because some of the questions might involve like telling which angle is bigger, and they're only a few degrees apart, and says put these in order of size, smallest to largest, and the angles that they're showing you, there's just these little differences. And so you have to really look at it and be able to discern differences in small, little small things. Also, there's questions about, like, they'll have, I don't know if you've ever seen those, like white and black blocks put together, and how many white blocks are there and how many black, and it's just it's kind of how you look at it too. So there's a whole section on spatial relations on the DATs that I don't think are on like the MCATs or something like that. So that's something to remember. And there's study guides and all that. So once you take your DATs, they look at that along with your GPA and, essays and why you want to become a dentist or whatever they're going to ask that year. And you get into dental school. From there, it's very important to know it is one of, and this is kind of, I'm not just going to sound like a downer or something, but it's one of the most expensive graduate schools out there. So it's something that if you really want to be a dentist, if you're going to go into it. Some people are like, oh, that's where you go if you don't get into medical school. No, really, you really want to be a dentist if you're going to do this, because those are expensive loans that you're going to be taking out. There are some alternatives to that a lot of people don't think about. Sometimes you can join the military, and there are scholarships through that. I did not do that, but I do know people who did. There was one of my classmates was in the Navy, and they were paying for his dental school. He applied for the scholarships after he got into dental school, and it worked out really great for him. And they paid for it completely. So that was, so there are different avenues to help with that, because like I said, it is very expensive, and especially at private schools. State schools are a lot better. I myself went to SUNY Buffalo, and it was great. I had a wonderful time there. I learned a lot, and the weather wasn't that bad. So yeah. I'm trying to think of anything else that you guys might be interested in learning about. One thing that a lot of people think about now are the differences between replacing teeth. So that's something kind of cool, because there's a lot of different groups that you can belong to when you become a dentist. And some of them might be on Facebook or other forums, And we really like to talk to each other about what's best for patients. And so there's a nice community of us out there that do talk to each other, and we learn from it. There's continuing education that is required in New York. So every 3 years, I believe you need 60 hours of continuing education. Some of it has to be live, some can be written. They are, I don't know if they're considering some of the like Zoom ones live or not. But over those 3 years, you have to take at least 60 hours. So you kind of have to take some every year to stay current. So it's really important because you're always learning. There's always new things coming out. And that's one of the things I really love about my job, is that the way I practiced when I first got out of school over 25 years ago is much different than how I'm practicing now. And that is kind of fun because you're learning and you're growing. And I'm sure a lot of other healthcare professions are like that as well. But that's something about healthcare that I think is really stimulating. And to stay in and to really enjoy your job, I think it should have some challenges and some changes every day. Yeah, that's so one thing. We have the rest of it. I was going to show you. Give me 1 second. Hold on. I am missing part of what I wanted to show you guys, but that's all right. I'll explain it. So this is a kind of a cool little model that I show patients sometimes. And I usually have a bridge that goes over the top thing. And what a bridge is a piece that goes over this and a piece that goes over this and has a fake tooth in between. And that's one way of replacing a missing tooth. So talking with patients, you have to give them different options, because it isn't just this is the only option for you. So, you can leave a tooth missing, and some people do. That's fine. You can do a bridge, which, like I said, spans this whole area. I wish I could show it to you. Or, I don't know if you guys can see that, you can do an implant. And so the implant part of it's pretty nice because you don't have to touch the teeth on either side. You place the implant in there, and then a crown goes on top of that, and that replaces the tooth very nicely. So a lot of times when I'm talking to patients, it's not just about the exam. I'm looking in their mouth, seeing what the problems are. It is actually going over, what's a good solution for them. So, cost is a big factor. But in addition to that, there's other factors, their health. To get an implant, you need to be healthy. Okay. If you have underlying health conditions, this is going to be a lot harder to get and a lot harder for you to heal, as opposed to a bridge or leaving it just a space. Another option to replace a tooth is, here it is. I'm sorry. I did have it. Here's the bridge. So that's what I was talking about with the bridge. It goes right over your 2 other existing teeth, and it replaces that tooth right there in the middle. The other option that I was talking about was, these are all tools I use in my office to explain things to people, which I think is really helpful, so that people know and can make an informed decision for themselves on what is best for them. So the other option is doing an implant. After an implant's placed, put a little connector piece in there, and then the crown goes on top of that. So that's that. Some of the things that you have to know about when you're helping that patient make a decision on which one might be best for them versus maybe something like a partial denture, which, again, this is a denture that might have only just 1 or 2 teeth on it and fits into that spot, is, their health. Like I said, pre-existing conditions, whether or not something like this can be placed. But in addition to that, you also have to look at things like physics. Physics is a really big part of dentistry because there's a lot of forces that go on that. You can put a tremendous amount of force on your teeth. And if you grind your teeth, or if you know someone who does, they can end up breaking their teeth. They can end up cracking them, eventually losing them. It is part of, especially grinding and clenching, is part of the development of periodontal disease. those are all things you have to look at. So it's multifaceted when you're coming up with a plan for someone. So, you know, otherwise, dentures. Okay. And some people do great with dentures. They lose their teeth. It's a great replacement. Actually, it's horrible. But I say it's a great replacement because it's better than no teeth. So if you don't have teeth, it's a good replacement. Sometimes if people can't handle that because it's just moving around in their mouth a lot, they can do something like this, where they get some implants on the lower jaw. I don't know if you guys can see that. There's 2 little implants that are placed there. And inside the denture are these little buttons that the implant just clicks right on. And it stays on. So that's an option. Again, this can be done with a prosthodontist, but it can also be done at a general dentist's office. I love making these for people because they're really awesome. Something else you have to look at with dentistry, we do work in conjunction with medicine. So if someone has sleep apnea, for instance, a lot of people end up having sleep apnea, and it's pretty pervasive in this country. Sometimes people don't want to wear a CPAP. I don't know if you guys have ever heard of that or what sleep apnea is. So obstructive sleep apnea is when you fall asleep, some of the structures that are in your throat or in your mouth will prevent airflow. So when that happens, you stop breathing while you're sleeping. And it can be really dangerous. Over time, it can lead to cognitive issues. It can lead to cardiovascular issues. So some of, you know, a lot of people end up going to their sleep doctor or, you know, a pulmonologist, and they'll get a sleep study done where they go to sleep with some stuff on, stuff in their mouth, and they find out they have sleep apnea. So when you have sleep apnea, the best thing you can do is wear a CPAP, okay? And so CPAP is a unit that just basically blows air into your airway so that you can breathe at night. It just continuously is kind of flowing in. It's kind of a little like putting your head out the window when you're driving 50 miles an hour, like, okay. And it's just blowing at you. So a lot of people don't like it. They're coming a long way. They're doing a lot of it. It's kind of gold standard for sleep apnea, but there's people out there who can't handle it. Or if they travel a lot and they don't want to take it with them, they can get a referral to a dentist to make something like this. So this is like a mouth guard on top and a mouth guard on the bottom. And there's some little pads in between to help keep your mouth open. And then also these things on the side will help bring your lower jaw forward and open. And by doing that, it helps to put tension on some of the muscles in your throat and in the back of your mouth to help keep that airway open. So that's another factor or another thing you can do in dentistry. Some people, I know one dentist who specializes in sleep medicine, and that is it. So he actually does the sleep studies and makes appliances or CPAPs for patients and helps them out with all of that. And he's completely done that. He's out in Colorado, does a great job with it. But then something like this can be made at any general dentist if they've taken the continuing education for it. So that's kind of a fun thing to do, is that you don't have to be stuck in just doing fillings or whatever it might be. If you like something, you can do more of that and refer out things that you don't like. So like in my practice, I like doing these. They're great because they really help patients out for breathing, and breathing, as we all know, is really important. And I really like doing cosmetic work. Not everyone does. It can be a little hard, especially if there's patients who are very picky or all that. But I kind of like that because to me, I want to do my very best and have someone have a great smile. So something in cosmetic dentistry is something like veneers. I got one right in here. Hold on. So not only veneers, but any kind of like, there's bonding and things like that that can be done. and a lot of other things. But you look at, with cosmetic dentistry, you're really looking at, not just the person's smile, because you can have the straightest teeth, but if they're not in the right position in your whole head, that can be a problem too. Color wise, I think we've all probably seen how too many people have overly white teeth. So you sometimes have to talk to a patient about that and be like, do you really, really want those paper white veneers on all your teeth? Because it's going to look fake. They're going to look like chiclets. So this here is a veneer. It is a very, very thin, as you can see. It almost looks like a fake fingernail for any of you who know what those look like. And they're super thin. They're sheer. Can't really hold it up to the light. They don't have to be sheer. This one happens to be quite translucent, which is very natural looking. And then that just gets, let me see if I have put it on. So that gets glued onto the front of a tooth to change the color, shape, size. That happens to be a porcelain veneer. You can make them out of bonding. So if someone has maybe these two teeth here are too small, which is a common tooth to be much smaller, or it's called a peg lateral. Something like this can be done on it, and no one would ever know. So those are a nice way of doing some cosmetic work. And but that's, again, something you develop and learn through continuing education, going to courses. I mean, they teach a little bit of that in dental school, but for the most part, something that it's more cosmetic, you are definitely going to want to kind of focus on yourself. There's dentists out there who don't want to do cosmetics. That's great. There's some dentists out there who love doing root canals. Even though they're not root canal specialists, they really like doing root canals. So, sometimes patients will go to them just for a root canal, even though they're a general dentist, and that's okay. Or they're doing it for their own patients and not referring it out to a root canal specialist. I'll do root canals, but I'm very picky and I choose the ones I want to do. Ones that are more straightforward or more towards the front, because those are ones I feel more comfortable with. If it's a back molar, that's going to the root canal specialist. But if you need gum surgery like this, I love doing that. So I've taken a lot of classes and done a lot of continuing education so that I can help people out when they've got something like this going on in their mouth, and get them back to a state of health from that. So that's something I really enjoy doing. I don't enjoy doing the grafting. I don't know if you remember that, where I said you can take a piece from the roof of the mouth and maybe put it on an area where there's been a lot of gum recession, or the gums are kind of pulled back from that. I don't like doing that. So that gets referred to the periodontist. So it's really great because you can kind of pick and choose what parts that you really enjoy and focus on those and get good at them. And you don't have to do everything. There are some people who do. There's some dentists out there, some friends of mine, who actually do it all. Good for them. That's great. I'm just more, I'm okay working with other people in our community and other people who have another dentist who have decided to go in different directions and kind of not mini specialize, but you're not board certified for that, but you've taken a lot of extra continuing education, really like to do it. And if you have passion for it, you're going to be good at it. So that's something that, you can keep in mind as well, that it isn't just a set job that, you're getting in there doing fillings, boring. It's helping people out. It's when you can make someone smile. There's so many times I've gotten hugs afterwards, and you can change someone's life. I mean, there's so many different ways of doing that. One, getting someone out of pain. That's a big one. Was there a question? I'm sorry.
I have a question.
Okay.
Thank you, Dr. Grace. I wonder, is this true that wisdom teeth, like every adult, like they reach a certain age, then every adult will have wisdom teeth? And if that is something that impacts your health, does insurance cover it, or yeah?
Okay, so wisdom teeth. Yeah, I didn't really touch on that. So wisdom teeth are also known as third molars. So this model does not have that. Okay, so usually it would just be a third molar. It's right back here. So typically in a mouth there are 32 teeth. Like I said, this model is missing the third molar, so you can actually count 1, 2, 3, 4, 5, 6, 7, 8. And that's there. So the wisdom teeth are in the back. Do all adults need to have them out? No. Some people have enough room for them. They actually come in just like another tooth and there's no problem. So that this is the most common missing tooth in someone's mouth. So sometimes people are just born missing teeth. I myself only had 3 wisdom teeth. I was missing 1 of them. So I only had to have 3 that were taken out because I have a pretty small mouth. Now, I see plenty of patients who that tooth has plenty of room, comes right down, no problems. But sometimes they're coming in sideways or they're impacting onto this teeth. So, or they're impacted. Okay, so you might have heard of an impacted wisdom teeth. That means they're stuck underneath the gums. That's not a great situation when it's stuck underneath the gums because it can push against the other tooth. It can cause the other tooth to absorb part of their root. So if there's another tooth pushing against this, you can either get a cavity in this area or it can actually resorb this tooth some. And then you have to have the wisdom tooth and this tooth taken out. So sometimes we look at it, we look at x-rays and we determine, okay, does this need to happen? Or sometimes we do small CAT scans on that so we can see kind of 3-dimensionally if it's impacting another tooth, and then take that tooth out. So when the wisdom tooth is taken out, there's different ways of doing it. Sometimes we can just take it out. Sometimes we have to surgically, open that area and remove the tooth in pieces. Again, some general dentists do that. I don't. That goes right to the oral surgeon. That's not my thing. So from an insurance standpoint, that was, and I will touch on insurance. Insurance is very different. And so I'm just going to talk a little bit about dental insurance right now. They call it dental insurance. It's actually a dental benefit. Insurance really, when you look at it from like a medical standpoint, medical insurance, you pay a certain amount and the insurance is going to cover whatever they say they're going to cover. So if it's like 80% of major medical, if someone gets in an accident or ends up in the ICU or something, they're covering 80% of that. Dental insurance is really more of a misnomer. It's more of a dental benefit. And what happens is your company pays something or you pay into it and you get a certain amount. Usually it's about $1,000. Sometimes it's $1,500. Very rarely is it anything more than that. And that coverage is for, say, $1,000 of their fees. So you either need to go to a dentist who has decided to lower their fees to accept that. Say it's a procedure that's $100. The insurance might say, we only want to pay $50, and we think it's only worth $50. If you're going to sign up with that insurance, you have to agree to only charge the patient $50, and then the patient's going to pay 25 of it, and we're going to pay 25 of it. So that's one aspect of dental insurance. Is there another question? Or okay. Yes? No? Am I?
What's the main difference between a dental hygienist and just a regular dentist?
And a dentist?
Yeah.
Okay. So with a dental hygienist, it's 2 years of school. I don't believe you need to have any prerequisites for that. So right after high school, you can go, if you get into a dental hygiene program, it's 2 years. And your main things that you're allowed to do are you can do cleanings, which is going a certain amount underneath the gums, or even a deep cleaning where you go a little further underneath the gums. You can do sealants, which are a little coating that goes into the grooves on the top of the teeth.
I said factory ads Buffalo.
I'm sorry, what was that? Could you repeat that? All right, I'm not sure what was just said. So the difference between the hygienist and the dentist is, even though hygienists can take x-rays on the patient, they can't do any diagnosis of the x-rays. They also can't do any diagnosis of actually, I don't believe anything like, a cavity or anything like that. So you can't diagnose, nor can you do any of that work. So from a dentist standpoint, and in New York, I believe in all the states right now, as a hygienist, you can't work without the supervision of a dentist. You can't own a dental office unless you're a dentist. In New York, you may be able to own a dental office, like a corporate type of thing in other states, but not in New York. So anything that you see that's a corporate dental office like Aspen or Heartland, or there's a few other ones, those in New York have to be owned by a dentist. So with hygiene, you are doing 2 years of school, and you have to do certain things, and that's all you're allowed to do. Where as a dentist, I can do all of those things and everything that I do, including diagnosis, which is really one of the more important things. So you're looking at diagnosis of gum disease, you're looking at diagnosis of any kind of cavities, of oral cancer, those things. So was there another question I could answer? Nope. Okay. Then I'll keep talking. I'll go back to the insurance part of it. So when you decide, as a dentist, if you decide you want to take insurances, so you're agreeing to, like I said, certain pricing, and then, you can do all the submissions for the patient, so that their insurance is either going to pay you or pay them, and those kind of things. We do work with some medical billing. So medical billing can be done with certain situations, but they're usually things like the sleep apnea appliance, which has to have a medical diagnosis. But that's used with medical coding. So with all procedures that are done in dentistry or medicine, there's a code that goes along with it. So if you get a tooth out, it's D7110. That's the code for an extraction. That's all I remember. So, but any other code, so if you get a child cleaning is going to be a certain code, and everything's done by codes, and that's for insurance purposes. So with anything in medical or dentistry, if you go to the doctor's office and you look at your, sheet that you're bringing up to the reception, there's going to be little codes on it that say what was done for that day. Same thing in dentistry. So like I said, we can cross code with medical, but most of our codes are D codes, which are dental codes. So that's just a little thing. It gets a little complicated sometimes. There's actually classes in it and everything. So not in dental school, which I really think they should teach that in dental school, but it's something you actually have to take in continuing education course to actually understand. So is there any other questions I can answer?
I have a question.
Sure.
So to do the thing where you said where you had to like inject someone and they could go to sleep, that's under being a dentist, like going to school for it, or you can be any career?
That you can take continuing education and do sedations. So that's something you can choose to do. You can actually do a specialty in it as well and do, so that's something. So it's either one. You can do it on the side. And there's courses that you take. Some of them are pretty involved and intense. And then there's other ones where, you can just become the specialty and go to a residency and do it. So I hope that answered your question.
Yes, thank you.
You're welcome. Is there anyone else who has a question? So one thing before I don't know exactly what time this goes till, but one thing I would like to talk about before anyone goes, if anyone is interested in becoming a dentist, one of the best things you can do while you're in college is to actually observe at a dental office. So when you go home, call your dentist. Say, hey, can I come and just check things out and follow you for the day or shadow you? I think it's a really great way of learning about what it's like to be at a dental office, but do it at more than one office. If it interests you, go to another office. Call my office. I don't care. I love having people shadow me. It's a really fascinating because that way you can see what it's really like, because everyone has their own idea of it, because of their own visit where they're sitting in the chair getting work done, but it's so different from the other side. So I think that's a really important thing to do. Go observe at an oral surgeon, go observe at an endodontist. I don't know any dentist who, if asked, isn't going to help, try to help you out and answer your questions. And everyone always gets excited, I think, when there's someone who's interested in what they do. So.
Okay, well, I'm afraid you're going to get deluged now because you said we could send you people, so we're sending them now.
That's fine. If you're interested in dentistry, I am happy to have that. Just give my office a call. So
great. So, do you make the sleep apnea appliances?
Yes, I do.
You do. Okay, we'll have to talk later because I my CPAP. Oh, it's just like you have to sleep on your face all night. You're doing this,
It is. It kind of looks like an alien, yes, but. Yeah. So, but they do work well for mild to moderate sleep apnea as long as you've had a sleep study done. Yep. And
I've had one done, so we're good.
Yep.
All right. Any other questions, people? Questions, comments? Well, thank you very much. It was an awesome talk. Really enjoyed having you here.
All right. I hope I touched on everything everybody wanted to hear. So.
I think so. And by the way, your teeth are beautiful.
Oh, thank you.
All right. Well, I'm going to go down now. Good night, everybody.